My name is Matt File. I was previously the Director of Operational Development and Human Resources for Clear Choice Healthcare. Clear Choice Healthcare is a management company that operates 9 facilities in the state of Florida, skilled nursing and rehab facilities. Currently, I'm the administrator at Conway Lakes Health and Rehab Center, and what we do here is provide rehab to senior adult population and also sometimes younger individuals that have had traumatic injuries or elective surgeries. Our main population here is rehab. Even though we're licensed as a nursing home, we fall under all those regulations of the nursing home. Our priority is rehab. We've been using Edge for approximately 4 to 5 years. The process with Edge is much more streamlined than our previous provider, where we rely so heavily on not only accuracy of the report, but the timeliness of the process. We do not use nurse agency at our company, so we've got to get the applicants through the interview process. They've got to get their background check. They've got to get their drug test timely. Otherwise, we are delayed in getting them into the facility and onto the floor, providing care to our residents. The other thing that we used to do is outsource our labs for drug screening, and Edge was able to come in, write our guidelines and protocols, and provide us a system where we can do the in-house drug screens, which probably expedited the process by at least 50%. So what used to take about 5 to 7 days to process an employee, now through Edge takes us about 3 to 4 days, unless there's any issues on our end. So that has been a great service. The other nice thing about Edge is the convenience of having everything that we need with one company. We run our motor vehicle requests, we do our drug screens, we do our background checks, and I'm sure there's some other services that they offer that we'll probably end up doing in the future. But basically for us, we only have to call one company to get all the answers in order to effectively process our employees. Okay. When the change occurred in our industry to have electronic fingerprints instead of the traditional in-house background check that we performed, it was a big change, and Edge was there to provide us all the protocols and guidelines to ensure that when the Agency for Healthcare Administration came in, we were accurately processing employees for employment. And Edge was great because they offered webinars, they offered on-site training, they offered almost 24/7 availability. I know we had called them our account rep many times after hours with issues. There's times where we are processing applicants at 5 or 6 o'clock at night, and most companies are closed at 5, where we can't close at 5. So we're a 24/7 operation, and at times applicants that are working other jobs have to come in, and it might be even later or really early in the morning, but we still have to process them. So when we were having these changes to the electronic fingerprints, we were able to get our answers quickly and not lose the applicant or not lose any step in the process which would put us in violation of the state requirement. I would recommend Edge, and I have recommended Edge to other employers because of the accuracy, the way they streamline the process, their availability, the fact that they're always updated with the ever-changing world of regulations that we have to live in the healthcare industry. Edge, every time a change occurs, has their system updated and is offering a webinar or offering something to make sure that each one of its facilities is in compliance with that change. So, having said that, Edge will always be recommended on our end to anybody who has a question.